I'll let you know when you're ready, Mr. President.
Excellent.
Live.
Zero camera.
Mr. President, you're live.
Wonderful. All right. Good afternoon, everyone. It is a pleasure here. I think we're about 34 days post session, and we are in a very different world. All for the most part, positive signs across the board. It is truly a pleasure to be here with you all. We are still remaining virtual. This is some of the lessons learned from session. We are able to get these things done without having to trek to Annapolis. So lessons that may be able to be applied in the after times. On the vaccine front, on the COVID front, I think across the board, we are seeing really positive metrics that, we are seeing a reopening and we are experiencing it in many different ways. Was able to join the Preakness this year in a constrained capacity, and it was hosted in the operations were very in low risk, but it was the first real sign that you could feel things sort of turning a corner. And so as we continue to maintain safety and vigilance, and as vaccines get out even faster, I think we are going to be in a really, really great place to start seeing what the world looks like on the post side of a pandemic. Certainly, the other thing I wanted to kind of point out up front is, from the beginning, we've been talking about the various phases of this vaccine rollout, that we would have kind of this initial short supply, kind of getting the providers up and running, getting the mass vac sites out. It appears we've been very successful thus far, and now we're sort of shifting into this new phase where we have availability, supply is strong. And so now we are kind of going into that increasing demand side and making sure that we are getting all communities, especially those who have some of the highest risks and who need it most. And so we're looking forward to hearing from the department on progress there to shift into accessibility and increasing our demand levels and kind of moving through this pandemic. It feels like we're getting closer and closer each day. So we look forward to the presentation from the Secretary, and I will hand it over to Mr. Powell, who will give us an update on the data thus far before we hand it over. Mr. Powell?
Thank you, Mr. President and Senators and Mr. Secretary. Jake, if you pop that up there, I'll quickly walk through this. This should look familiar by now. So we've been tracking a couple of COVID-related metrics since vaccines became available in mid-December. Testing's down 44%. The number of positive cases is down 81%, and the positivity rate is down 65%. That's of a few days ago. I think I saw today that it declined even further to, I think, Mr. Secretary, the lowest positivity rate that Maryland's ever seen. So all positive there. Next slide. This shows that positivity rate since mid-December. You can see the huge decline, the kind of increase in the late winter and early spring, and then what we've experienced recently. So should be familiar with this. Next one, please. So we put a map. This says new cases since 3/3. It's actually since, I think, 4/13. I just titled that incorrectly, so I wanted to clarify. The darker a dot is, a dot's a zip code. The darker it is, the higher the case rate per person. And then the larger the dot is, the larger that zip code. So if you see a small dark dot, that's a place with a high case rate, but not a very big population. And if you see a large, lightly colored dot, that is a low case rate in a large zip code, a zip code with a lot of people. Next slide zooms in on the sort of 95 corridor. You can see most of the new cases, again, since mid-April, are in the greater Baltimore area, including Eastern Baltimore County, Western Baltimore County, Southern Hartford County, Northern Anne Arundel County. You can also see, a bit of a distinction between, say, Prince George's County and Montgomery County. But this is where new cases have been recently, although in context, it is a much smaller number of new cases than we had been experiencing a few months ago. Next slide. These are new case rates by age cohort. All of them have declined. The decline has been the most for people over 80 years old. It's been the least for children younger than 10 years old. New case rates are currently highest for people in their 20s and 30s. But you can see pretty dramatic decline for all age cohorts. Next slide. Also see a decline for all races and ethnicities. Although I'll note that Black or African American Marylanders still have the highest case rate, but again, a decline since about a month ago for all Marylanders, regardless of race or ethnicity. Next slide, please. So we've tracked this for a while, and I think this is encouraging, although I've not run it by our epidemiology friends. The blue line is the positivity rate. The orange line is the number of COVID deaths. While the while the positivity rate increased in the late winter and spring, the number of deaths remained relatively flat. And if you note, in the last few weeks, that number has declined from where it was a while ago. So hopefully we are getting to the point where we're no longer losing people from COVID. Next slide. Same thing, except instead of deaths, it's hospitalizations. I saw on the MDH website today that I think the number of people currently hospitalized is just over 600. So that's improvement even from when we collected this data late last week. Next one. Vaccinations. So this is the trend in all doses, whether it's a single dose, a first dose, a second dose. There's a big spike in mid-April. That is a data anomaly due to the federal government reporting well north of 100,000 doses that had been administered sometime in the past few months, but are all sort of accounted for on that date. But you can see, Maryland's gone from averaging maybe close to 70,000 shots a day, and that has declined recently to probably closer to 45,000 a day. Again, all shots, regardless of first or second or a single dose. Next slide, please. Ratio of first doses to second doses. We've been tracking this forever, not exactly sure what it would tell us. Currently, I think for every 10 people getting a first dose, about 25 people get a second dose. So, if you go to your mass vax clinic, most of those people are there getting a second dose. Next one, please. This is a map of vaccination rates by zip code. So just like before, the darker the dot, the green dot, the higher the vaccination rate, and then the larger the dot, the larger the population in that zip code happens to be. So you can see in, let's see, in Hagerstown, I think that's that light yellow one with a relatively low vaccination rate, but a large population out in Washington County. North of them, there's apparently a zip code that has not a lot of people, but a lot of them have been vaccinated. Next slide zooms in again on the sort of I-95 corridor. You can see that sort of inside the Beltway suburbs in Prince George's County has still got, it's a cluster of low vaccination rates. You can see what we already know, which is at fairly high rates across the board in Montgomery County, Howard County, and some other places as well. Next one. We've been doing this from the beginning. This is how Maryland compares to other states as far as first doses and full vaccination. And I think we're somewhere around 10th or 12th. It changes based on the day. This is based on CDC data. It's over 50% of the population that's gotten a first dose. That population takes into account, kids who aren't eligible for doses as well. And that varies from state to state a little bit. So I just want to note that. But, Maryland, if you remember a few months ago, was sort of at the bottom left of a graph like this, and now we're sort of in a better place. Next slide. Let's go one more, Jake, if we could. This is sort of the daily vaccination rate by race. This is for first doses, and it's declined for everyone. I will point out that for the last couple of weeks, a higher percentage of Black or African American Marylanders have been getting first dose vaccinations than white Marylanders. Next one, please. This is the same thing by race, but it's for people getting fully vaccinated. Can we see that next one, slide 16? There it is. This will probably change to look like what the last one looked like in a few weeks as people are able to get their second dose. Let's move on to the next one if we could. Same thing for ethnicity. I'll note that, in the last few weeks, Hispanic or Latino Marylanders have been getting vaccinated at a higher rate than non-Hispanic or Latino Marylanders. Although you can note that for all ethnicities, that rate is declining. Next slide. Same thing by ethnicity for people getting fully vaccinated, either the second dose or the Johnson & Johnson vaccine, relatively even most recently. Next one, please. We introduced this a few meetings before the end of the session. The further you are to the right, this is for 70-year-olds, that sort of vaccination rate. So I believe it's over 85% of 70-year-old or 70-somethings in Maryland have gotten a first dose at this point. The height on the graph represents that sort of current rate of vaccination. So you can see, obviously, it's very low, but that's because most people who have been eligible have gotten the vaccine. And the next slide, if we could, shows the same thing for people over 80 years old. And you'll see a similar curve where almost 80% of people over 80 have gotten a first dose, but that rate has dropped off to where I think it's only about 1 in 1,000 gets a vaccine these days. But again, if you think about it, if you had 1,000 people that were over 80 years old, 800 of them have already been vaccinated. But every day we're getting one more, but the rate has slowed dramatically. Next one, please. Sorry, can we see slide 21? Sorry, am I stuck on 20 or?
Yeah, we're on 21.
Mine is stuck, unfortunately. Let me flip over for a second so I know what I'm talking about.
There it goes. It updated. It was.
Oh, great. Can you share again?
Now we need to reshare. We've been out of practice for a month.
I'm going to describe what I hope is what people are seeing, but it's the vaccination rate for the 8 largest counties in Maryland, a decline basically across the board in all of them. I'm actually ready to move on to 22 if you were able to see 21. 22, let me see what you guys are looking at. Nothing currently. Sorry about that. So it just shows, Baltimore City is still a little disproportionately low in the number of people that have gotten vaccinated. Same for Prince George's County. I believe the lowest vaccination rates in the state are Allegheny County and Somerset County, and the highest are Montgomery and Howard. And I only have one left. It's the same thing. It shows the rest of the counties in the state. I'll again point out Washington County, Allegheny County, which had a lot of cases and deaths last year and are still vaccinated at a fairly low rate. That's all I have. Thank you for your time, and I can answer any questions if you have them.
All right. Thank you, Mr. Powell. I'm sorry for the technical glitches we had there. We do have that final slide up here. And I imagine there may be some additional data. So we can bring those up for questions too, if there are specific county by county questions as they come forward. But without further ado, let's hand it over, and hopefully our technology will work on getting let's make sure that we have the presentation available for the secretary. I think the department has some data to provide. Jake, can we pull that up? Yeah.
We're having some
It appears we need to get some broadband coverage to the Weissman household. While we were working, why don't we? Well, it appears I am the host now. So I think we lost Jake. So we're going to go with what we got. Secretary Schrader. Hopefully we can. I suspect there may be a logging out and a logging back in happening. But as we go, feel free, please, if you want to kick us off with sort of the opening remarks, and we will get it up there as quickly as possible once Mr. Weissman is able to join us again. Oh, let me unmute you.
Can you hear me now?
Now we can. We're good.
Thank you very much. Good afternoon, Senators. Appreciate the opportunity to update you on our progress since we met last early April. Last week, the governor said on Friday that our long, hard-fought battle against the worst global pandemic in more than a century has reached a significant milestone. Following CDC guidance and in consultation with our health department and medical experts on Saturday, we lifted the statewide mask mandate and capacity and distancing restrictions. The multi-pronged strategy that we put in place more than a year ago, and executed and modified along the way, has produced tremendous results and enabled us to do this. So if I can go to the next slide, thank you. To date, we have vaccinated more than 5.7 million Marylanders. That's 66.5% of our 18 plus population. We have vaccinated more than 86.9% of our 65 and older population. Our positivity rate has fallen, as Mr. Powell said, now down to 2.51, the lowest it's been since September of 2020. And our number of COVID hospitalizations, 613, is down more than half since April of this year. All good signs. Next slide, please. We have Maryland's team has, and all of government effort has been nationally recognized by independent experts as one of the best COVID-19 responses of any state in the country. We should all be proud of that. A recently released report by Sykes ranked Maryland as having the second most effective response to the pandemic in the United States. It also lauded our firm policies, particularly our stay-at-home order early on, as being effective. And recently, Wallet Hub ranked us fourth in the country in the lowest COVID-19 transmission rates. Next slide, please. The Kaiser Family Foundation National Equity Rankings are also very good. They were published last Wednesday. We vaccinated 60% of the Asian population, ranking us third in the nation. 38% of the state's black population, also ranking us third in the nation. And 34% of the state's Hispanic population, ranking us fifth in the nation. Next slide. We also rank among the best states in the country when it comes to ensuring that underserved and vulnerable and hard-to-reach populations are receiving vaccines. The vaccine equity, which we've talked at length about in these sessions, remains our focus. It also is the focus of Brigadier General Burkhead, whose tenacity and the 380 clinics the task force has conducted in zip codes hard hit by COVID-19. Her team has vaccinated nearly 82,000 Marylanders, And the New England Journal of Medicine, Catalyst, recently highlighted the success and efforts of the task force, stating that it's worked diligently to reach the state's vulnerable population by partnering with trusted community, faith-based, and nonprofit organizations. The study also concluded that Maryland has been very effective in reducing vaccination disparity, stating that over the course of 7 weeks, the overall state of Maryland equity index improved by 48% for black individuals 65 and older, and by 36% for Hispanic Latino individuals 65 years and older. And last Wednesday, Bloomberg credited Maryland for one of the biggest increases in the black share of people vaccinated in the nation. Next slide, please. All of this and other data clearly show that our all-of-government effort has been extremely effective, and we still have a tremendous amount of work before us. We're nowhere near done, and we're going to remain focused on our ground game over the next several months to make sure that no arm is left behind. We're on a march to Memorial Day, which is when we project we will reach 70% of Marylanders vaccinated with at least one dose. That's about a little over 164,000 shots or first doses that we still have to do. Last week, we expanded eligibility to include 12 to 15-year-old Marylanders. We've already vaccinated about 27,000 of them, and launched a new online tool the day the CDC recommended using the Pfizer vaccine for this age group. We have approximately 307,000 12 through 15-year-olds to vaccinate, and have initially made the Pfizer vaccine available to them at our 11 state-run mass vac sites and more than 300 pharmacies. We're actively expanding the Pfizer availability this week across the state to include local health departments, hospitals, pediatricians' offices, and other locations as we refine our cold chain logistics. Next slide, please. Let's see. This gives you a overview dashboard of a 65 plus. I think the important thing here is that we still have approximately 125,000 individuals 65 and older that we are looking for and are actively going to pursue in vaccinating. So again, we're not going to leave any arm behind. Next slide, please. Equally important, we recently launched an online dashboard on the Department of Aging website to transparently track vaccine rates for both nursing home residents and staff. We're working with urgency to vaccinate all eligible Marylanders who are still not vaccinated, and it's essential to protecting them from death and protecting our healthcare system. We will be moving away from the high throughput vaccination sites to the lower throughput, hard to reach sites just over the horizon. And this is when we focus more of our energy on the pull side of the equation, which is going to take longer and be much harder, but we've got to get it done. And the mobile vaccination clinics will be a key tool for us throughout the summer. Lastly, and among other issues, we are developing our statewide plan for booster shots. On our Friday weekly call with the White House, I asked about their strategy for boosters, and we'll have more to say about this the next time we meet. So I'll stop there, Mr. President, Senators. I look forward to your questions.
Thank you, Mr. Secretary. I am trying to hold the, let's see. Okay, there we go. We had an internet outage, so I was trying to present there. Hopefully I got through the slides well enough. Thank you for that information, and very, very helpful. I have a couple of questions that are sort of higher level questions, and I'm curious as we move into phase two, this or not phase two, I shouldn't say it like that. This next phase of demand increasing. Are you getting a sense from, or have you been doing any kind of informal surveying of those who decided today for the first time to try and get a vaccine, or is it still the same transportation technology barriers, or has that shifted? And where are we headed in that department?
Yeah, I think it remains the same things we talked about earlier for access, transportation, trusted community organizations. I'll give you an example. Working with Senator Rosapep over the last month, we partnered with CASA down in Prince George's County, and they've been enormously helpful to us. And we're doing regular, and so we're trying to recruit other organizations that can help us in the same way. Kaiser, for example, they have a very, we partnered with them early on. They have about 400,000 members in Maryland. I visited with them in Prince George's last week, and they've done really well, but they're still at 53–54%. So they've got a lot of work to do. The good news about them is that they have lists, the same as CASA. So what I'm looking for all around the state are people who have lists that we can call. Another approach we're taking with Medicaid is we've got CRISP, and we bounce the Medicaid database against CRISP, and then we're going to be making outbound calls from our call center to try and reach people there. So this is going to be really hard work, and it's going to take us a little longer. Yeah. It's going to be a lot harder. And probably a little more expensive, but we're not going to give up. We're going to keep moving.
That's very helpful. The physicians had reached out, primary care physicians as vaccinators. I know this was something that you had mentioned early or several months back about the pilot programs. Curious where that stands for vaccinator site at primary care.
Yes, we're now distributing to over 371 practices have received vaccine. And we're continuing to deliver to them as well. That'll be another key channel as I talk about the ground game. So we're going to get smaller numbers on a daily basis, but we're going to, it could take us another 6 months, quite frankly.
Yeah.
So it took 6 months to get well over 3 million. It'll probably take us another 6 months to get the next million. It's just the way it's going to work.
My final question is more of a tactical operation policy. We've gotten some reports of sort of, and nursing homes, I think, are the most obvious example of it, where family visiting policies have been restricted, rightfully so for public health reasons. But if a vaccination rate is only at 50% in a facility, the facility has kept those family visitation policies in place, and we know kind of the emotional impacts that has taken. Has the Department of Health are there any plans for moving policies forward to kind of open up visitation policies? I know this has to do with mandatory vaccination of staff, and so I don't know how those two values interact and if that's something that the department will engage in.
Well, there's two different issues here. One is we have people on the ground. We've set up technical assistance teams who are going in and continuing to vaccinate. We removed all the restrictions and adopted the CDC guidance. So, we don't have any restrictions that are over and above what CDC requires to make it easier for the nursing homes. And of course, the long pole in the tent is going to be the final approval of these vaccines, moving away from an EUA. In the meantime, though, we are pressing the nursing homes to continue to vaccinate their staff, and that's why we're going to their facilities. And then the last thing we're doing is encouraging the nursing homes to do one of two things: either get a pharmacy partner who will deliver vaccine to them and provide that service, or for their get their own Immunet requirement and have them receive the doses. But either way, we're going to keep pushing for them to continue vaccinating.
That makes sense. Just to clarify, the EUA versus final approval, is that the issue about mandatory vaccination? Is that the
correct?
That's the crux there. Got it.
Yeah.
Thank you. All right. We will go in order. We've got about 30 minutes here. We have Senator Lamb, followed by Senator Eckert, Young, Washington, Rosapep. So we'll start with Senator Lamb.
Thank you, Mr. President. Thanks for the presentation, Mr. Secretary. A follow-up question. I know that we had touched on this during the session, and that is pertaining to equity and making sure that our under-vaccinated populations, particularly those who are ethnic minorities or the African-American population, have been vaccinated to the degree that other parts of the population have been. I think when monitoring the numbers over the past few weeks, the percentage of people that are African-American that have been fully vaccinated has still remained kind of around 20-21%, in spite of the task force's efforts to reach out to this population. What more is being done to reach out? Because I know those efforts are ongoing, but it still has seemed kind of stagnant over the last couple of weeks.
Yeah, no, you're right. We're about 21.5% on the African American side. We have been climbing on the Hispanic side to just the other day hit 6%, and we've got to get to 10% on the Hispanic population. We're finding that the mobile vax numbers, I was very encouraged. I was reviewing the mobile vax earlier, and on the Hispanic side, we're reaching 20% when we do the mobile vax sites, but we're still at about 21% for African Americans. So what I think I mentioned earlier, what we're going to start doing is working with the Medicaid population. We want to go into areas and partner. For example, we started with Morgan, has now got an operation. But I think what we're going to have to do to reach people is get the zip codes, check them against our CRISP data, and then start doing more outreach, even more than we're already doing. And we're not going to give up until we get everybody. And what will probably happen, and I think you saw this in Mr. Powell's data, you're seeing that a greater percentage of the vaccinations are going to minorities and Hispanic community in the last few weeks. So we're looking to see that trend continue, and it may take us longer, but we're going to get there.
Yeah. So thank you. I am concerned about Mr. Powell's data because it does show that those inner suburbs of Prince George's County to DC and also inner city, Baltimore City, are also kind of areas that are under-vaccinated, and those kind of tag along with the fact that those are more predominantly African-American population. My other question follows up on President Ferguson's question with regards to nursing homes, because we are concerned that staff in nursing homes are vaccinated at a lesser rate than that of residents. And even in the data that you presented, it's about a 15% gap when you look at the residents' vaccination rate to staff vaccination rate. Unfortunately, what that means is that if any staff turn positive, that shuts down the entire nursing facility to any visitors, which is already pretty traumatic to many residents who have been there isolated over the past year or so. What is the state doing to increase the vaccination rate for those staff members? You mentioned that folks are going out to these nursing homes and trying to increase that, but is there more that we can do? Is there, for example, an ability to even incentivize nursing homes to get their staff vaccinated, just like we've incentivized state employees to get vaccinated?
Yeah, we're encouraging the nursing homes to do incentives. Our first step, we're trying to apply steady pressure. So it's been about 2 weeks now. I think it was a pretty important step to publish publicly the data on the aging website so it could be transparent. We've also made the nursing homes aware of the fact that the EEOC law does allow them to be a little more aggressive, but they aren't there yet. So we're going to keep pushing. We're going, into the nursing homes, providing the vaccination capability. It's just it's a steady push. The problem with the EUA is that it's a slippery slope when we start telling people they have to be vaccinated and they refuse with a vaccine that is not fully approved yet. So one of the other things we're doing for nursing homes is providing them with materials to encourage the staff. We've given, there's nursing home staff and also nursing home owners who were using the GoVax campaign to push out to the nursing homes so they have materials to encourage their staff. So we're going to stay very close to it. It's a fine line.
Could we increase Medicaid reimbursement to these nursing homes to help incentivize them to get their staff vaccinated?
That hasn't been on the table yet. Interesting idea.
Okay. And with regards to the mass vaccination sites, now as we're seeing supply obviously exceed demand, the number of people going to the mass vaccinations has declined in reflection of what we've been seeing more broadly. What is the plan for the department to reallocate those resources from these mass vaccination sites to other outreach efforts? Is there a plan, and what do you see as those next steps for reallocating these resources from the mass vac sites?
Yeah, we've been working on that planning for about 4 weeks now. EY has been fantastic in giving us very detailed projections, and we've been using those projections for that planning. And we are already figuring out, because the demand is softening, there's no question about it, and at the right inflection point, we are going to be moving some of those resources into more mobile vax, more door-to-door maybe activities, et cetera. So we're working on those plans as we speak to get that and moving the leadership of the mass vax into this ground game. So that planning is underway. We haven't decided what the threshold is yet, but we're monitoring very closely so that there'll be a point where one goes down and the other goes up.
Thank you so much. Thank you, Senator Lamb.
Thank you.
Senator Eckert.
Thank you very much. And thank you, Mr. Secretary, to you and your team and down through the health departments. And I know what I've been hearing on the ground, and we've been on the ground with a number of our outreach folks, that because of the vaccine not being fully approved, that's where the resistance is in a lot of the professional healthcare provider circles. But it's also on the streets with particularly the younger minority folks not wanting to be guinea pigs. There's a real sensitivity to that. So a lot of education and outreach has been necessary, at least here on the shore. And then reaching out, as you said, to those specific population, just a continued encouragement from your end. If you could encourage, if there are coordination, if other groups are doing things in the activity, let those outreach workers know so there's not duplication of efforts. We ran into that a little bit. I think we've got it pretty much straightened out. And then as much as possible, it may be the need, and I think most of the healthcare providers are a way of, targeting and going into specific groups. Again, that's worked very effectively, going to the churches, going to the pop-ups that are out and around in the community. And we have a big one this weekend in Cambridge where all the agencies are coming together. And that's a great way to involve the community. And it also sets the stage for some of the newer outreach health initiatives that we're going to be doing in the future. So thank you so much for your leadership and constant reminder of folks to work together. That's really important. And thank your staff for responding to the healthcare, the childcare facilities, because again, there's still a need for childcare and getting those opened up. Camp season is approaching. So a lot of our childcare providers have seen a real decrease in the number of children that they're able to serve. So hopefully we can get some improvements on that. And thank you.
Excellent.
Thank you, Madam.
Thank you, Senator. Senator Young? Oops, Senator Young, I think we need to unmute you. There we go.
You got me now? Okay, yeah. Thank you, Mr. President, and thank you, Secretary Schrader, for your presentation and for your responsiveness when I've called or tried to call your office. Several of my questions have been covered, but I got 3 or 4 little ones. Maybe I'll machine gun you with them and
Sure.
talking and let you do it. How many people have gotten one shot and not gotten a second one? And are you doing anything to reach out to try to pull those people back in? And I know that a goal has been set for 70% Memorial Day for one shot. Do you have a goal to hit 70% people fully immunized? And do you have any particular plan to convince parents of these 12-year-old plus to get their kids vaccinated? It appears nationwide that's not a very high priority right now with the parents themselves. And last one is, have you thought of anything like some other states are using, from lotteries to money to anything, to encourage those that are holding back to say, hey, something in it for me, I'll try getting the vaccination?
Yes, sir. Okay, so on the first shot, I think you probably saw we're about 3% rate, which is significantly lower than other parts of the country, which are upwards sometimes 8-9%. We are still trying to track down that 3%. And I think we've been very as you recall in many of our conversations early on, we've been very disciplined on the second shots. Now, of course, that the vaccine is widely available, we've sort of loosened that up a bit, but we've been very vigilant on getting that second dose scheduled and then following up with people. So that's about 3%. On the 70% of 18 and older, we have to get to about 184,600 shots over the next couple of weeks. So we 10, 12,000 a day to hit that 70% goal. But even then, we're going to keep pushing because the White House announced that target, and I think for July 4th, the governor is holding my feet to the fire at Memorial Day. So we're moving along, but we're not going to stop there. We've got to keep going. On the parents for 12 to 15, we've already got about 26,850 children 12 through 15 in 4 days, which is, of 307,000. We're closing in on 10%. And so we're watching carefully to see how that demand holds. We're not sure yet, but that gives you an idea of where we are. And then in terms of incentives, we're looking at any and all opportunities. We haven't landed yet on what those are going to be. You probably saw the governor offered a $100 incentive for state employees, but we're looking at a range of ideas. But we're not. And I think you probably saw the Lido Pizza idea that was announced last week. But there's a range of things that we're analyzing and assessing, and I think that's going to be really important going forward.
Just real quickly, you were talking about 70% by Memorial Day. That's first shot. How do you have a goal for when we have 70% that are fully
vaccinated? So it'll probably be about 3 weeks after that when the second shot is given. But even with one shot, there is some immunity. So, if I could ask you a question, Senator, too, you mentioned, sure. What do you think of that lottery idea that Ohio's doing?
I kind of like it. And at first, I thought it was excluding those that had already done their duty, but I found out they're covering anybody that's had their shots. So it's not only for those to get them. Anybody that's gotten their shot goes into the lottery.
Okay, good. That's helpful feedback. Thank you.
Whatever it takes. It's my perspective. Whatever it takes. Thank you, Senator Young. Senator Washington.
Thank you. Thank you, President Ferguson, and thank you, Secretary. It's good to see your full face.
Yes.
I have a couple questions, different buckets, but at first I just want to follow up on what my colleagues were mentioning around long-term care and visitation. I have a concern about, and again, this is about the vaccine distribution work group, but this is your role in general as our public health officer, that there are morbidities that are going to occur sort of, I believe, as a result of family members not being able to visit their families. So I would like us to strongly look at allowing by executive order or by your order an opportunity for family members to be able to have a compassionate visit. Right now, it's only allowed if death is imminent. As Senator Lamb has mentioned, there's been a lot of back and forth. One day, the rehab or long-term care visitation is open for one day, and then the next day it's suspended. And so the individuals being able to actually look at their parents and look at their loved ones is really, really critical. So I would like to very much follow up with you about it. We need to have a way for family members be able to get their eyes on their parents. The long-term care facilities are operating at reduced capacities. There's not a lot of the observation and care that is happening as a result of decreased staffing, which is understandable. But again, we're going to have a lot of deaths associated, COVID associated, not of COVID, but because of individuals not being able to see their families for a year and a half. So I don't know what your thoughts are about that initially, but would you be open to finding out if there's a way to have a one-time, someone's vaccinated, being able to go in and put eyes on and inspect their family members?
Well, first let me start. I agree with your premise that we have to be as flexible as possible. We have actually removed all the restrictions that are Maryland-based and are following CDC guidance. We could talk offline if you would like to advocate for us loosening up CDC guidance. We'd have to have that conversation.
Yeah.
It is a double-edged sword, unfortunately. But there are no Maryland restrictions on nursing homes.
Right. No, but I just will tell you that most of them are not allowing visits, and there's only a visit if somebody, so we can talk about it. It's going to be a problem. And so I'd also like us to maybe look at some data associated with that. Are non-COVID deaths increasing? Are other kinds of deaths, increasing? I think that might be something that we really need to look at. Infection rates, things like that, I think are probably on the uptake. The second one is, you mentioned it a little bit, about us. What's our goal for getting all people vaxxed? Is that 70%? Are we looking at the goal of getting 70% of the Maryland population vaccinated? And is that when we think we'll get to herd immunity? Or I want to get a better understanding of that.
Yeah, 70% is basically a federal milestone that's been established, but we believe we got to go a lot further than that to get to herd immunity. Pick a number, 85, 90, 95. We're going to keep going until we get a higher vaccination rate. That's why I was saying it could take us another 6 months. It took us 6 months to get to where we are. We vaccinated almost 3.2 million Marylanders. To get to the next million could take us 6 months. So we're going to be grinding this. It's going to be a grind.
So we're aiming at, you think, 85% in 6 months? Is that the?
I'm not sure how long it's going to. Yeah, I want to see how much we've got as we ramp up this ground game. I want to get a feel for how successful we are, and so I'd say just over the horizon as we start to flip from focus on mass vax to surging resources into community-based strategies, we're going to have to see how well we do. Yeah. But it's going to take, my point is it's going to take a lot longer to do fewer people.
No, and particularly this last 20 is going to be, this last 25, this last 30 is probably going to be 3 times or 4 times as hard as the first 60. And then finally, how many mobile vax units do we have? And as we're transitioning, which it seems like we could be transitioning from the max vax sites into more mobile units, I mean, could the state have 25 mobile units or have 1 mobile unit for every county and 2 for larger jurisdictions?
Yeah, without getting into detailed numbers, we're going to have a lot more mobile assets than we currently have. That I can assure you. One of the things I'm waiting to see, the HSCRC has put grants out to the hospitals, for example, and we want to see how much they invest in mobile and rolling stock. We're giving them a lot of doses. So I'd say the health departments, the hospitals, local physicians are going to be really key in this next phase of this process. But I'm seeing either a lot, and when we're talking about mobile, that includes rolling stock and pop-ups.
Okay.
So a lot more pop-ups, I think, too. And particularly using pharmacies with closed pods, for example, we're really encouraging a lot more of that too.
And I'm sorry, one more, and we could follow up another time, but I'm
Sure.
interested in the contractors. So, my mom was a nurse, my neighbor's a nurse. So you have some retired, you have nurses that are helping with the mass vac sites. And I was just wondering, this is just back to administrative. Is the state contracting with a particular, how are we doing that? How are they getting paid? How is that being managed? Is the state contracting with one provider who is hiring the nurses? Is there what are those entities that are involved in that? If you could maybe tell us back, because there's this agency, Aya, I think.
The used to be called the Chesapeake Registry that we've been working. We can get you more information on that. So for clinical, it's Qualivus. It used to be Chesapeake Registry, and they were bought. And we're using Haggerty for the non-clinical out of MEMA. They're at hiring.
And for the shots, one of the things that I guess a constituent raised is that she is her understanding that we're paying for like 12-hour shifts, and that individuals are getting paid 12-hour shifts whether they work the 12 hours or not. So some of the vac sites, because there's the volume isn't as high, they're sending people home. But I'm just wondering, are we still paying for the full 12 hours, and then they're paying? My constituent is not getting paid for the full 12 hours. She's just getting paid what she works. So if you could kind of check that out and say, to make sure that, that our people are getting paid, but also that if we're paying an agency for 12 hours of nursing, that we're actually getting 12 hours of nursing. Thank you.
We'll check into that.
Thank you.
Senator. Senator Roosevelt. Nope, we need to unmute. Just a moment.
Try again.
There we go.
Am I live? Okay, well, thank you. And thank you, Mr. Secretary, for all the work that you've been doing with us in Prince George's over the past couple of weeks. You said you'd focus on it, and you have focused on it. We still have a long to go, but we really appreciate the focus. Got a couple of unrelated questions. First is following up on Senator Washington's about herd immunity. Have you done, or has the White House done, or has somebody done, and if you haven't, please do it, some analysis of what I would call regional herd immunity? I mean, I don't know how to model it myself, but it cannot be the case that if 100% of the people are vaccinated in California and 20% of the people are vaccinated in Maryland, that we're that safe. And so it must be immunity in the circles you travel in. Is that something that you guys have models on or data on?
No, I'd have to. I need to think about that one. That's it gets into what's our future surveillance going to be, and we've done some preliminary sero surveys working with hospitals, but we're looking at how to ramp that up because you're right. There's going to be different rates of immunity. And having the shot isn't the only thing that will create the immunity.
I understand that. But I'm just saying strategically for this next phase, I think it's important. And if somebody isn't doing it, they ought to do it. I think. We agree. If nobody else. So that was question number one. Question number two is, we clearly are into the hesitancy phase. I say that based on my personal knowledge in my district and talking to people. Do we have data on that? Not in the vaccination rates, but attitudinal data. Has the state, has the federal government actually real time been questioning people? So we have some sense of what the accessible market is and what the inaccessible market is. Do we know that now?
We've been monitoring that with survey data over the last several months. So we've known for quite a while that 60% of the people want to get their vaccination from their doctor, and then we parse out folks, and so we've got that data. If you're interested in
if you would share that with us, I would deeply appreciate it. It goes to targeting that everyone's got to be working on, and it would be very helpful.
And it's shifting, by the way, too.
I'm sure. That's why real time is important. People change their minds. No, I believe me. If you could get that data, that'd be wonderful. I wanted to come back to this question in nursing homes, which I knew about, but I have not personally gotten these complaints. So I appreciate my colleagues raising them. And you made some reference to a legal problem with the approval by the FDA. The Attorney General of Maryland has issued an opinion on this. And the reason I know it is I'm the one who asked him for it. And the opinion says that their judgment is that it is, I don't know what the legal term is. I'll defer to the Senate President on the legal term. But basically, it's okay to require mandatory vaccinations of kids coming back to university, which is where I started the issue, employees at universities and other employers, because the general public health discussion that CDC and everybody is that these vaccines are safe. And therefore, there is not a legal bar to people, organizations who want to require vaccines to do it. So I was a little confused by what you said about nursing homes.
Yeah. So here's what we're looking at is the difference between an entity like the university or a nursing home deciding that they want to do that. That's perfectly and they have coverage from the EEOC laws.
Right.
Okay. That's different, we believe, than the state unilaterally granting that. But if you could share that opinion, I'll ask our team to pull it out. Well, I'd like to look at that language, and we can talk.
I get the distinction you're drawing, but with all due respect, with all the emergency decisions that the governor has made over the last year, the overwhelming number of which I agree with, it just strikes me that in those situations, nursing homes are a perfect example, where it's in the public health interest, and senators have said, of the people of the state of Maryland, that people who work in nursing homes get vaccinated. So I really would ask you to pursue that. And if there's something we can do to help, I think we all be happy to. The last thing I wanted to raise, I'm all for the mobile vax. I'm all for all the stuff we're doing. One of the things I've learned, I would say over the past couple of weeks, talking to local health officers and just talking with hospitals and people who are doing this stuff, is that it's not just a ground game. It's going to places where people already are. It's right. Going to their apartment complex. It's going to their grocery store, going to their employers when people work on site.
Yep.
The question is, back on employers particularly, then I'll cut it off, Mr. President, is what is our employer strategy to do vaccinations at employer sites across the state of Maryland for their employees?
Yeah, that's part of our strategy. Just last week, we were over in Prince George County meeting with some employers, Hispanic grocery store owners, and we want, and then the Hispanic Chamber, and others. We're talking to we want to go. We will go to employers. That's part of when I talk about the ground game. That's all of that. Everything you just said is part of the ground game.
Thank you very much, Mr. President.
Thank you, Senator. There was a very successful, I think, administration of employer-based at Pompeian.
Great.
So that was just very successful. I think it helped for a lot of people that were sort of waiting. So I think that employer strategy is a crucial one as well.
Great.
So thank you very, very much, Mr. Secretary. Just a couple final notes. Just want to thank you and the department and the efforts of the administration and members for the ongoing vigilance. Obviously, this is continues to be the most important thing that anybody is doing in state government. And we are here to help, especially on creative ideas, as the department considers those creative ideas and just ways to change public health messaging to get those, get people to have that confidence level as high as possible. And we will follow up directly with the department about potentially future meetings. Right now, we don't have anything scheduled. We'll follow up as deems appropriate. And we just appreciate your work and look forward to the ongoing engagement the rest of the spring and summer. And by the fall, let's make sure that kids are back in school full time, please, whatever it takes.
Thanks, Mr. President. And I look forward to the follow-on discussions, and we appreciate your support in all these efforts. It's very helpful. So thank you.
Thank you very much. And members, we will be in touch. We appreciate each and every one of you, and we will talk soon. Stay safe, everyone. Get that vaccine.